Today we're going to dive into a very important topic that affects millions of people in the world, maybe even you, gastroesophageal reflux disease. You know that burning sensation in your chest you feel after you've had a very big spicy meal? About 10 minutes later, you start feeling your chest burning and it feels awful. That's exactly what I'm talking about. Now, before we get started on GERD and how to cure it and how to feel better and all that exciting stuff, we need to talk about the structure of your digestive system. It's very important to understand this structure in order to help you visualize what's going on exactly. The journey starts in the mouth. After you put food into your mouth and you chew it a little bit, you start to swallow. Once you swallow, this food enters a very long tube, about 25 centimeters long, called the esophagus. Now, the esophagus is this food tube that connects your mouth to your stomach. This tube is actually behind your trachea or your airway. Now the food travels all the way down to your stomach. At the very bottom of this tube, there is this gateway between the esophagus and the stomach. This gateway is known as the lower esophageal sphincter. Now, what does this sphincter do usually? This sphincter is responsible for shutting down the stomach as it secretes acid. Your stomach secretes acid to break down food. Now, it's very important to mention that in the stomach, this acid doesn't exactly damage the walls of the stomach. The reason is there are some protective factors inside your stomach that prevent this acid from damaging the walls. Now, here's the problem when it comes to GERD. Remember that gateway I mentioned between the food tube and the stomach? In GERD, what happens is this gate or this sphincter begins to loosen a little bit. And when it loosens, this allows the acid to shoot all the way back up. It goes into the esophagus. You remember how in the stomach we mentioned that the walls are protected from the acid? That's not really the case when it comes to the esophagus. The esophagus kind of relies on this gateway to remain shut to protect it from the acid. So if this acid goes back to the esophagus, this causes a burning sensation. Your esophagus is essentially burning. The walls are burning from the acid coming from the stomach. That's not very cool of that lower esophageal sphincter for it to just stop working for no reason. So let's discuss the causes of why this sphincter begins to weaken a little bit. It isn't exactly clear why this sphincter begins to fail, but there are some predisposing factors that weaken the sphincter. Drinking alcohol regularly, smoking regularly, obesity, overeating, lack of exercise, sometimes even pregnancy can cause the sphincter to fail. Now, unfortunately, sometimes there's no real cause that is identifiable for this sphincter to begin to weaken. Perhaps it could be aging or genetics, we don't really know, and that obviously could cause GERD for absolutely no reason, and your body loves to do that a lot of the time, so it is what it is. So now that we've talked about why GERD occurs, let's talk about some of the symptoms that may occur in order to understand what is normal and what isn't. Obviously, the most common symptom is heartburn, or this burning sensation you feel all over the chest. This burning sensation can even sometimes spread to the neck or throat. That symptom in specific, generally, is not that concerning as long as you are following up with a doctor. What is concerning, though, is when you start developing some of the more rare symptoms or more complicated symptoms of this disease. And these include something known as dysphagia. Dysphagia means difficulty swallowing. If you experience difficulty swallowing, then that is not a good sign, and you should probably get it checked out with your doctor. Other sets of symptoms we call red flag symptoms include unintentional weight loss, blood during vomiting. How do we manage GERD? And how do we control it? Or how do we cure it? First off, a very important principle when it comes to medicine is that we always start simple and then move into more and more aggressive procedures. So let's apply that to GERD, for example. The first thing we do to manage GERD and prevent it is lifestyle modifications, which means changing your habits, changing your eating, changing your sleeping positions in order to prevent the symptoms of GERD and to control it. For starters, this could include avoiding trigger foods such as spicy food, alcohol, caffeine, and even fatty food. Yeah, I know it sounds very depressing, but this is probably the best way to prevent the onset of GERD from happening. Eating smaller quantities of food and spreading your meals more frequently throughout the day but in smaller portions is also something helpful you can consider. And obviously after eating, you should not be lying down on your back, because when you are lying down on your back, you're essentially allowing the acid to sort of leak back over to your esophagus. Now, gravity generally when you're standing or when you're sitting will allow this acid to sort of sit at the bottom of the stomach and not go back up to the esophagus, at least not so easily. When you do lie down, you're kind of losing this gravity that is controlling the acid level, and you're spreading it all the way up to this specific sphincter, and you can allow it to go through. That's why another lifestyle modification is when you do go to bed, sometimes it is recommended to sleep on an incline, because that allows the acid to go down because of gravity. It's simple as that. Now, if all of that fails, all these lifestyle modifications, we've removed the alcohol, we've removed the caffeine, we're lying down on an incline while we're sleeping, we're not sleeping right after big meals, and none of that worked. At this point, we can consider medications. These medications include things like PPIs, or proton pump inhibitors. What they do is that they prevent the secretion of acid in the first place, or things like antacids, which sort of form a coat around the stomach and the esophagus to prevent the damage of the acid itself. So these medications are sort of the second line of treatment after lifestyle modification has failed, and they're very effective. Usually they do the job once they are given. Now, in some cases, if medications don't work, if lifestyle modification don't work, then we have to go to the last line, which is surgical intervention. We need to do a surgery to make sure that this acid does not go back to the esophagus, or to control it at least. The reason is, if we let it continue for a very long time, it may cause very, very dangerous complications that we don't really want, and we can prevent and we can manage if we control the disease early on. If GERD over time is not treated, more serious complications start to arise. These include things like esophagitis, which is the inflammation of the esophagus itself. Strictures can develop. Strictures are basically narrowing of the esophagus because your cells are trying to repair it, but they're not very good at repairing the esophagus from this inflammation, and they start to narrow it down and shrink it. That starts to difficulty eating, difficulty swallowing. That's not very good. The most serious complication when it comes to GERD is something known as Barrett's esophagus. What is Barrett's esophagus? Remember when we talked about the stomach way back, that we said the walls of the stomach are sort of specialized to protect it from acid damaging it? Your esophagus, over time, after being exposed over and over again to this acid, starts to change the composition of the wall to protect itself from this acid. It sort of looks like a stomach now, but it's sort of more of the intestines. Now, wouldn't you think that's a great thing? It's like, oh, so your esophagus is trying to protect itself by changing itself. That's great. Not so much. This changing of the wall, which in fancy medical terms is called metaplasia, along with the constant exposure to this acid over time, can predispose to cancers of the esophagus. Barrett's esophagus in itself is considered a precancerous condition. It's not cancer yet, but it could be. The good thing is, most of the time, about 90% of the time, Barrett's esophagus does not progress to cancer, which is great. But there is still that 10%, which is not great. It's very important if a patient has Barrett's esophagus to continuously monitor and take snippets to monitor the cells to make sure nothing has transformed into cancer. Well, that brings us to the end of the discussion on GERD. I hope you did learn something about GERD and why this happens, why this annoying disease that affects millions of people is happening, and I hope you learned something about the digestive system as well. Again, if you are experiencing any symptoms of GERD and you are undiagnosed, please talk to your doctor about it, get it checked out, it doesn't hurt, and obviously you can talk to your doctor about any concerns. Thank you for watching, and I hope you have a wonderful day.